When is a football field like a hospital floor? When teamwork helps accomplish goals. As a registered nurse, former coach Asamoah Anane has learned that teamwork, communication, and caring are just as important as scientific knowledge.
My name is Asamoah, and I'm a nurse, and I like taking care of patients.
Same stuff, it's the same material that was coming out.
A nurse is basically the quarterback. You have a doctor who's writing orders, you have a pharmacy who's taking care of the medication, you have a nutritionalist, a dietitian, you have physical therapy, you have occupational therapy. When it comes down to it, the nurse is the one who's coordinating all of that for the patient, because the care that's being delivered is always by the nurse. So the doctor can write the orders, but you're the one who needs to give that medication. You're the one who needs to deliver that care. You need to know your job, you need to know what everyone else is doing, coordinate that care like a quarterback basically, and then deliver the care. Your mouth, Ron. You do need to be compassionate, you need to also be empathetic. You need to think of yourself as a person who's in that bed and what would make you most comfortable.
My concern is, what happens if I get the pain in between?
On top of that, you need to advocate for that patient. A lot of patients who come in may not know exactly what's happening to them. They may not know their disease process. They may not know what's going on. And you need to fill in that gap of information. There's only about a 10% male population in the field itself. It is primarily females in the profession. But when I got into it, I was looking at it, number one, could I support my family in this role? Which I could. Number two, is it something that I would enjoy? Which I found out very quickly is something I would enjoy. And there's a science aspect to it, there's a clinical aspect to it, and I also get to do what I wanted to do, was to take care of patients. When you do have patients who are very sick, there's a professional aspect to it, but you're also human, so you always have to deal with your own emotions, and you do that by talking to your colleagues, and it's a unique profession. When your patient comes in and they're basically comatose, and you get them from being comatose to sitting up, reading a paper, talking to their family, hugging their loved one, you've done a good job. There's no feeling like it.